The year is 2024. The world is still reeling from the social and economic aftershocks of the COVID-19 pandemic. We remember the fear, the uncertainty, and the devastating loss. Yet amidst the darkness, we also witnessed remarkable resilience and innovation. The rapid development of vaccines was a testament to human ingenuity. We learned to adapt, embracing remote work and virtual connections. However, the pandemic also exposed vulnerabilities in our global systems. Supply chains faltered, highlighting our interconnectedness and the fragility of just-in-time delivery models. Mental health became a silent crisis, underscoring the profound impact of isolation and uncertainty. The pandemic served as a stark reminder of our shared vulnerability and the need for proactive preparedness. As we navigate a world forever changed by COVID-19, a sobering question arises: are we prepared for the next pandemic? The hypothetical emergence of COVID-25 forces us to confront this possibility, not with panic, but with a determination to learn from the past and fortify our defenses for the future. The COVID-19 pandemic catalyzed unprecedented speed in vaccine development, paving the way for a new era of medical response. Imagine a scenario where COVID-25 emerges. This time, armed with the knowledge and infrastructure built during the previous pandemic, scientists can develop and deploy vaccines at an even faster rate. mRNA technology, a game-changer during COVID-19, could be further refined, potentially allowing for the development of vaccines within months, not years. Moreover, the pandemic accelerated the adoption of remote work and telehealth. These technologies, once niche solutions, became essential lifelines for businesses and healthcare systems. In the face of COVID-25, we could witness a seamless transition to remote work models, minimizing disruption to daily life. Virtual healthcare could become even more sophisticated, allowing for remote monitoring, diagnosis, and even treatment, reducing the burden on hospitals and minimizing viral spread. The COVID-19 pandemic forced us to adapt and innovate. Now these advancements offer a beacon of hope, a foundation upon which we can build a more resilient and responsive future. The 21st century is the age of data. We generate an unfathomable amount of information every second. This data, if harnessed effectively, has the potential to revolutionize pandemic response. Artificial intelligence and big data analytics could act as an early warning system for COVID-25. Imagine AI algorithms analyzing real-time data from sources like social media, news reports, and even wearable health trackers. By detecting unusual patterns, an uptick in flu-like symptoms for instance, these systems could alert public health officials to potential outbreaks before they spiral out of control. Furthermore, AI could be instrumental in contact tracing and predicting the spread of the virus. By analyzing mobility patterns in social networks, AI models could help authorities implement targeted interventions, such as localized lockdowns or testing campaigns, slowing down transmission and minimizing disruption. The use of AI in pandemic response is not without its ethical considerations. Privacy concerns and the potential for misuse must be addressed. However, the potential benefits, early detection, targeted interventions, and ultimately, lives saved, are undeniable. On the precipice, navigating the uncertain impacts of COVID-25. Technological advancements offer hope, but COVID-25 would have far-reaching consequences. Economically, the world could face another period of uncertainty. Supply chain disruptions and market volatility could trigger a global recession. However, accelerated innovation could lead to new industries and economic models. Socially, the pandemic could exacerbate existing inequalities. Access to healthcare and basic necessities could become further stratified. Mental health could reach a crisis point. The shared experience could foster global solidarity and cooperation. Geopolitically, COVID-25 could test international collaboration. Competition for resources could lead to tensions between nations, but it could also present an opportunity for countries to come together. The potential impacts of COVID-25 are multifaceted and uncertain. We must recognize the opportunity to build a more equitable, resilient, and interconnected world. Building resilience for a healthier future. COVID-25 reminds us we live in an interconnected world, vulnerable to infectious diseases. We can't predict the next pandemic, but we can prepare. Preparedness starts with education and awareness. Stay informed, practice good hygiene, and get vaccinated. Strengthen local healthcare, support vulnerable populations, and foster communication. Governments play a crucial role in pandemic preparedness. Invest in research, strengthen health infrastructure, and develop response plans. International collaboration is paramount. COVID-19 was a wake-up call. It exposed vulnerabilities but highlighted resilience and innovation. Embrace lessons learned, invest in preparedness, and foster global cooperation.